Wondered how a physical therapist becomes the CEO of a thriving clinic network? Today on the Wellness Growth Show, I'm joined by Dr. Negin Jalayer, founder of Marathon Physical Therapy, where she shares her journey from hands-on clinician to leading multiple clinics. She dives into the innovation therapies she's brought to her practice and explains why leadership and communication are at the heart of her holistic approach to patient care. If you're curious about the future of wellness and what it takes to build a standout PT business, you're in the right place. All right. Today we are sitting down with Dr. Negin Jalayer, CEO and owner of Marathon PT. Welcome.
Thank you, Scott. Thank you so much for having me on your podcast. I'm excited to be here and to share a little bit about myself.
Love it. Love it. Okay. I would love for you if you could just walk us through your journey from clinician to clinic owner.
Sure. I started my career as a physical therapist in 2004. I worked for a few companies and as I was a staff employee, I always felt like I treated these places as my own. So I always had this vibe or this feeling towards wanting to be something bigger within a company, whether it was advancing inside the company or not. And then, being an immigrant coming to this country at a young age and knowing that the sacrifice that my parents made to give me and my brothers a better life, I knew, that being my history, that there was something bigger in line for me. Not that being a clinic owner is bigger than being a staff employee, but just something I wanted to do something special with that. And so I had this opportunity that came my way. My past employers were looking to sell their business and they contacted me. The timing was just right. And so that was how I became a practice owner after probably, let's see, maybe 8 or 10 years of just being a staff PT.
Okay. And thinking back, like what maybe first triggered being like moving into the PT world? Like, was it something in high school or
Oh,
maybe you
yeah,
can share something about
absolutely.
that?
So I was being the younger sister to two older brothers. I was always playing sports growing up,
Okay.
and that actually really made me become a better athlete because I always got my butt kicked by them. So I had to be better. So I was a pretty good athlete in high school. I played three sports consistently. I played soccer. I was a goalkeeper. I played basketball and I played softball, and I was a left-handed catcher.
Oh, wow. Okay.
Uh, I, uh, being active in sports, I think naturally I felt this propensity for wanting to do something health related, fitness related. And at the time, I think the buzz was all about sports medicine. And so I really thought I'd be going down that path of health wellness. And then I came to find that I fell in love with physical therapy. It was something where I could be able to help people get better, but it wasn't down the medicine route, which I think it didn't really interest me much. And so it all sort of just worked out. I found that I loved physical therapy as I was learning about it and during my academic curriculum. And at the school that I went to, we actually were able to very early on do co-op training. So it was part of our education where they allowed us to go and paid work as almost like a rehab tech or a physical therapy aide, um, and be able to get a feel for the profession as we were in our schooling. So a lot of time for a lot of us that was an amazing way for us to be able to know, hey, is this what I'm going to do for the rest of my life? Um, and so it was, and I mean, I'm happy to say it was. So
Okay. So now how many clinics do you have?
two clinics. I've had one clinic for 13 years, and then I opened my second a year ago. So it's 1 year old. That's what I keep saying about
Okay.
it. It's 1 year old. But
Okay. And what's maybe one of the biggest surprise or challenge so far now that you've got your year into the
so
second one?
Yeah, that's a great question. So I know running a business, you should have great systems in place. But I think this definitely, for me, I found that if I didn't have my systems in place, if I didn't have a good leadership team in my original clinic, my first clinic, and I didn't have ways of empowering say my leadership team and other staff members that my presence not being at the first clinic would be felt, and not in a good way. So that was one way for me to be able to stay very in touch with my one clinic while I was helping to grow and foster relationships in my second clinic.
Yeah, that's important. Got to have good systems, good team. Otherwise, the second one's not going to succeed, right?
Yep.
Okay, so now you've incorporated therapies like what red light, shockwave, hyperbaric oxygen therapy.
Yep.
Maybe you can share a little bit of like what those are.
So we have a class 4 laser in our one office. So it basically, the technical term for what it does is photobiomodulation. So it delivers light energy into our tissues, whichever area of the body that we're shining the light onto. And that helps to boost energy production. So, people always talk about mitochondria, ATP. It helps to decrease inflammation naturally, and it helps to optimize healing. So that's one modality that we use when we need those certain, when we're hoping to promote those effects in the body. Another one is shockwave therapy. So it's delivering very high pulsed stimulus to the tissues, and what it does is it helps with tissue regeneration, so it'll help the tissue heal better. That's also another modality that we offer. And then the hyperbaric is something that we're still putting efforts into marketing a little bit more, because not a lot of people know about it, although it's been around for a long time. And we have a mild hyperbaric oxygen therapy chamber, so it delivers not the higher grade that a hospital setting would deliver, but it
Okay.
still has profound benefits. It doesn't mean less is not as good. And so that is good for anything. I mean, I could talk about it being good for neuroplasticity, so helping your neurons, helping damaged even nerve or other tissues heal better, helping wounds heal better, helping an athlete's body for recovery. The benefits of it are just so profound. Basically, it's one modality where the only one that I can think of that can deliver oxygen to all the cells in your body. And so it's great. And it's something that I myself have to do a better job at promoting and marketing,
Mm.
because I believe so much in it.
Yeah, what would you say led to adding these and how have patients responded?
Sure. So patients have responded amazingly to our red light and our shockwave therapies. They definitely feel profound difference when we add that modality as part of their care. The hyperbaric, like I said, I have to still do a better job at introducing it. I kind of
Yeah.
added it at the same time I opened the second clinic. So I didn't really do it justice yet by promoting it enough in both of our communities. But what led me to add these things, I've always had this passion for wellness for myself. And so I think I guess I'm like a health junkie in a way. So I'm always
Yeah.
researching ways in which, how can I better my health? How can I optimize my health? How can I do all these things for myself? It always translated, okay, wow, this is amazing. This has worked so well. I want to share it with others, and I want to promote it in my physical therapy space. So that was a very natural thought for me, knowing that I know this works. Let's introduce it to our patients. So
Yeah. Okay. How do you define, I guess, wellness in the context of physical therapy?
for me, wellness right now, as we learn and hear more, because there's such a buzz around health, preventing disease, right? There's so much more buzz.
More about prevention, right?
Oh, yeah,
Yeah.
absolutely. And how to almost like reverse your aging or optimize your health. There's so much buzz out there about it, but I've always known that I think how the body feels translates to how our mood is. And we see it with patients day in, day out, like they're not feeling good. They're a little bit more grumpy. They have constant headaches. How can you even focus and get your job done? We see it as physical therapists all the time. But for me, wellness is helping people to get stronger, to feel good, and then to become resilient. So to really better prepare their bodies as they age, it doesn't mean age is a bad thing. Age is natural, right? But just to make sure that they can still feel good, not just physically, but mentally. To me, that's wellness.
Yeah, and hopefully to continue doing things that they love or it's
Absolutely.
at some capacity, even if it's not as much, but but still being involved in those things. Good. Okay. And how would you say you've evolved as a leader now that you're not just treating, you're building, and managing a team. You've got now multiple locations.
Yeah, that's a great question. I think as you grow, and especially adding a second entirely different space, right? A second clinic. And I talked about it a little bit before, but I knew that I had to put certain key people in leadership roles in my original clinic, my first clinic. And for me as a leader, I always look at I think of my employees as assets. They're the extension of me. They're the extension of my company and our brand. And so for me, it's always been important to figure out who are those key players, to promote them and to empower them. So give them their certain responsibilities, give them really clear expectations of what I basically would like for them to do. And a big part of doing all that is the communication. So for me, that's been a natural next step, because I think you have to serve your people well as an owner. They're not just employees to me, they're sort of a part of an extended family to me. Always hope to give them what they give to me, their time
Yeah.
and their energy. So yeah, I hope I answered that well, or it made sense.
Yeah, and you mentioned communication is key. I'm just curious, is there any method that you guys, your team like to use? Do
Yeah,
you have any
sure.
tools or?
Yeah, definitely. I mean, I'm always big on not just therapeutic technology like the modalities we spoke about earlier, but what's happening behind the scenes, right? How are we communicating as a growing team? So we use some apps, some HIPAA compliant apps to be able to communicate very effectively. We're not all in one space. Actually, we have people in all over the place at
Okay.
times. And so we have to be able to communicate together. So that is a challenge, and it's actually something that I'm working towards bettering. So we have softwares in place to communicate, but at times our communication can become too much, which is not a bad thing. But basically, we're trying to figure out what's the best way to communicate as a team of many people without it like causing, a lot of like stop and goes during everyone's workflow during their day. So that's one thing that we're actually are in discussions about right now to try to see how we can improve that.
Those are like best practices of
Yeah, we communicate.
when to respond.
Yeah, yes, yes. And then, when to just to make sure it's not too much, because sometimes you're in your day, you're doing your thing, and then you get all these messages which can sort of paralyze you sometimes from getting stuff done.
Yeah, imagine it's like, and then you lose focus, and you're trying to give each patient their time. If
Yeah.
somebody, if everybody's like having a full on conversation, you're seeing a patient that could be very distracting. So,
Yeah, sure.
okay. Yeah. Okay. So what would you say nowadays, like, or you got your second location, you're a year in, what's the future of marathon PT?
Sure. So I would say the future of Marathon PT would be to continue to serve and give really quality care to both the communities that we serve, to develop ourselves more as not a one-stop shop, but a place to go when, for a patient who's like not sure what the heck is going on with my my left shoulder hurting and my left hip and my left knee. So to be able to really be great diagnosticians for the communities that we serve, to use our technology that way. I didn't speak about this, but we are doing some diagnostics in our practice, which are
Right.
musculoskeletal ultrasound. So being able to almost like a sonogram. People are very familiar with what a sonogram is, but being able to look under the skin and see exactly what's going on inside your joint in real time, not waiting. We can do it for you almost instantly. Another form of diagnostics that we've brought in is doing EMG, which is checking the health of how your muscles are working, and then nerve conduction studies. So checking the health of your nerves. And in doing those tests, we're able to be able to tell, okay, is this pain that you're having, is it locally because a nerve is affected in your arm, or is it coming from your neck? So we'll be able to, we are able to tell patients again in real time, this is what's going on. You have a condition at your neck that's referring the pain all the way down into your fingertips. Um,
That's
Or no,
impressive.
it's
Yeah.
not that, it's more, okay, you have not a good mobility around the nerve right in your forearm, which is causing
Okay.
an issue down into your hand. So
And
I yeah.
sorry, do you see this on a screen kind of thing? Is it like a
Yeah,
tell us
so
a little bit more. Yeah, go
sure.
ahead.
So with the nerve testing, and I don't do it, so I'm not the expert to ask, but it's we use a machine that's, and the person who does it is trained to be able to at times see certain things on a screen and hear certain things. And then with the musculoskeletal ultrasound, like it's on a screen and you can
Yeah.
see inside the body. Again, I'm not trained in it, but it's similar to what, like, when you go get a sonogram as a pregnant lady and you get a picture
Okay.
of the baby. So very similar to that.
And what kind of patient, I'm just curious, would want to see this, or maybe might they be experiencing that they
Oh,
would look
sure.
for
So
something like this?
for the musculoskeletal ultrasound, any form of joint pain, knee pain, shoulder pain, elbow pain, ankle pain. So any form of that, you're wondering what the heck, why is this joint hurting so much? And when I do these certain activities. So that helps us to be able to diagnose very accurately. Okay, we see this is injured in your knee. Could be the cause of the pain that you're having here. And so obviously we'll tie it in with what the patient is telling us. What are your
Got it.
symptoms? When does it hurt with which certain activities or movements? And then with the nerve testing, it's going to allow people to avoid a lot of times unnecessary care. So if the nerve is injured here, right in my forearm, and I'm
Okay.
having an epidural injection done in my neck, might not be warranted because the injury or the insult is here. So our hope is to be able to give accurate answers to our patients so that they're not wasting time getting unnecessary, maybe injections or other different treatments or other even like further testing. So it's
Got it.
helping to streamline their care, get them better more quickly because we know exactly what's going on.
Thank you.
And I would say, I know you asked about the future of marathon. I would say, it ties back to our mission, which is to change lives in the communities that we serve. It's to empower the people who meet us, to get them to not only feel good, but to revitalize their desire of physical and mental well-being. And so it sort of, I know,
That's good.
that
Yeah.
it
Okay.
brings it
What's
back.
what's one thing you wish more clinic owners knew about integrating wellness into traditional care?
Yeah, that's an awesome question, Scott, because I feel like a lot of times we just don't know enough about wellness. So I think if you are curious about it, or if you want to, if you're thinking about it, just do it. You have nothing to lose. Just incorporate one thing and see how it does. Um, yeah, just do it, because it's only going to better the patients you're already serving, right? So you add a certain something that a patient it could be really helpful to them. And so there's really, to me, no loss. Of course, there's a financial investment you have to make, right? In training and things like that. But in the end, there's really no loss.
Sounds like a lifestyle as well. It's like being preventive and doing things that help take care of yourself
Yeah, absolutely.
before you're injured or before you get sick, kind of thing, like
Absolutely.
make it a lifestyle. Okay.
Yeah.
Where can people find Marathon PT?
Oh, sure. So I'll give you my website. It's www.map.
All right. Well, thank you for this. I really appreciate this.
Thank you, Scott. I was very honored to be here.
Thanks for tuning in to this episode of the Wellness Growth Show. If today's conversation sparked something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.